All right, with that, I think we'll just go ahead and get started. We have a great panel to kick us off this morning, and Richard Serino, who's a member of the committee and also a distinguished visiting fellow from Harvard, will be the moderator for session 5. Richard, it's all yours.
Good morning, and thank you, everybody. And the conversations yesterday and the discussions that we had yesterday, to me, were the best part of the day, and we gathered a lot of information. And as we start to go through today, looking forward, and I'm fortunate to host this panel with 3 great people, and I'm going to actually let them introduce themselves, because rather than me just reading words, I let them, in their own words, introduce themselves. So, Tegan Boehmer, start.
Good morning, everyone. My name is Tegan Boehmer. I am an epidemiologist by training, and I work at the Centers for Disease Control and Prevention and the National Center for Environmental Health. I have been at CDC for 13 years. The last 2 of those years, I have been the chief of our health studies section, which includes our disaster epidemiology and response. So in that capacity, I oversee a small and mighty team of staff who work to build capacity of state and local territorial health departments to collect morbidity and mortality data following disasters and work with them to do community needs assessments and other methods and applications of disaster epidemiology.
Kelly.
Hi, I'm Kelly Baker. I'm the state registrar for the state of Oklahoma. I actually started with the state of Oklahoma almost 25 years ago when I was 12. I've had a varied career with the state. I've worked in maternal and child health for several years. I worked at one of the largest county health departments in the state. My background is biostatistics. I graduated from University of OU with a master's in public health in biostatistics. Yeah. After that, I came back to the state. I worked in tobacco prevention and surveillance. I took over the behavioral risk factor surveillance system. And then I went into our healthcare information division, which ultimately became our Center for Health Statistics, and ran that division for several years. We built our informatics division. We built an online web query system, and we were partnered with Vital Records at that time, which was a really great pairing. It may seem kind of odd, but in healthcare information and health statistics, we have no money. Vital Records has money, but they don't necessarily have the technical expertise to put in the good quality data. So when we were paired up together, those sister agencies, it was a match made in heaven. So that worked really too well. So our agency split that up a few years ago. But we still work together really very well. I have been state registrar now since 2006. We've been through a lot of disasters in Oklahoma. When I started in 95, I started January 2nd, and April 19th, we had the bombing. And so while I was in maternal and child health at the time, I was tangent to it, but I saw a lot of the work that was going on. We've also had several large tornado outbreaks that have come through that have killed a lot of people. And so Oklahoma is no stranger, unfortunately, to disasters.
Thanks, Kelly. Frank.
Thank you. My name is Frank DiPaolo. I know many of you have had an opportunity over the last day or so to speak with you, and I've enjoyed the conversation over the last day. And I have a number of comments I would like to make about some of the discussion. I think I can answer some of your questions. I currently serve as the Deputy Commissioner for Forensic Operations at the New York City Medical Examiner's Office. I'm a physician assistant by training. I worked in emergency medicine for many, many years in various ERs. I came to the New York City office of the Chief Medical Examiner for 9/11 as an emergency hire, spent 5 months at Ground Zero, and have managed most of the incidents in New York City since then. My other background is I was a New York City paramedic for a number of years, so I bring an interesting perspective to this, from the paramedicine side on the street to the ER to as a hospitalist, working in various hospitals, as well as from the medical examiner's office. So I look forward to an opportunity to speak in a few minutes.